Hello, welcome back. I'm Dr. Janine Johnson. You're watching this video because you or someone you care about has fibromyalgia or fibromyalgia-like symptoms. When you have fibromyalgia, the symptoms are you have chronic fatigue, you have all over body pain, you feel like you have the flu 24/7, you have headaches, digestive issues, you don't sleep well. It pretty much just wreaks havoc on your whole life and your quality of life. Now, you can have fibromyalgia, and there could be a host of reasons why you have it. In fact, I could have 10 patients that have fibromyalgia, and they all have a different reason why they have it. Typically, when a person is treated medically for fibromyalgia, they're given medication, sometimes Lyrica, which is actually an anti-seizure medication. But for those patients, a lot of patients like yourself, who are still looking for answers, it doesn't handle most of the problems. And the reason is that when you have a chronic condition, you can't be medicated back into good health. The type of health care that we have in this country is wonderful for acute care. But when it comes to helping a person with chronic care, managing purely with medications is pretty lousy. And that's why we have so many people seeking other answers, because there's a host of other symptoms that just aren't addressed by taking medication alone. So what I want to share with you today is our unique approach. We take a three-prong approach when we help patients with chronic conditions. We look at you metabolically, which means that we're going to do lab testing and we're going to look at your physiology and your biochemistry, see how things are working, where the malfunctions or the dysfunctions are occurring in your body. We're going to look at you neurologically. A person with fibromyalgia, a lot of times will have brain fog, they'll get lost in conversation, they can't think clearly. So we want to look at the right and left side of your brain, and in fact all lobes of the brain and the nervous system, to see where you may be having some problems there. And then third, we want to look at you structurally. We want to look at your alignment in your spine and see if that's a factor in causing some of your fibromyalgia symptoms. When I take on a patient, what I do is I address them as the individual that they are. And let me tell you how I do this. First thing we're going to do is we're going to look at you right here. This is you. We call this the web of physiological dysfunction. And first thing we want to probably do is, after we get your history, is order a complete blood panel. Now you're thinking, I've had a ton of blood work done, right? I've had a ton of lab testing done. You haven't had this done. This is a comprehensive panel, also known as a Chem 55. And we look at doing a complete blood work with a auto differential, a CBC with auto differential, where it breaks down the red and white blood cells. We're going to look at your liver, your kidney, your gallbladder, how all those things are functioning. We're going to do a complete lipid panel where we look at cholesterol and triglyceride. We're going to look at blood sugar. We're going to look at anemia. There are 12 different types of anemia. You probably have not been checked for that. We are also going to do a complete thyroid panel. And the reason being is that a lot of people with fibromyalgia also have thyroid issues, and that has not been evaluated to the extent that it really should be. You may have had a thyroid panel where they looked for TSH, which is that thyroid stimulating hormone. Maybe T3, maybe T4, but usually that's all looked at. The reason being is, medically, you're going to be treated based on the number, the evaluation for the thyroid stimulating hormone. Whatever that number is, it should be within a certain range. And if it's not, they're going to give you medication. So there's really no reason medically to evaluate anything other than that. But we look at things functionally, and we want to look at the bigger picture. So we're going to look at TSH, T3, T4, total T3, total T4, free T3, free T4, T3 uptake, reverse T3. A lot of these things you probably haven't even heard of. We're also going to look at thyroid antibodies. Again, the reason why is that a lot of times people that have fibromyalgia also have thyroid issues, and they may have an underlying autoimmune component to their condition. The most common autoimmune condition is thyroid, so that's why we look at the thyroid for antibodies. We may also want to check you for any food sensitivity, so that may be gluten, egg, soy, dairy. You may also be cross-reacting to foods. And what I mean by that is that you can have foods that you wouldn't necessarily consider to be bad, but they may be causing a reaction in your immune system and wreaking havoc on your health. People with fibromyalgia don't sleep well. They are awake at 3 o'clock in the morning and dead tired at 3 o'clock in the afternoon. Their sleep cycle is all over the place. The adrenal stress test is a saliva test. You spit into a tube 4 times a day, and that's going to evaluate your cortisol levels, your DHEA, and a lot of times we will also look at your male and female hormones when you do that test as well, because all these hormones start to interact with each other and cause havoc with each other. You may have heard of leaky gut, maybe you haven't. Leaky gut is, I want you to think of leaky gut like the screen in your window. The screen in your window lets the air in and keeps the bugs out. When you have leaky gut, it's like there's a hole in that screen. So things that don't normally get into your bloodstream now can get into your bloodstream, like food and viruses, bacteria. So we want to see if you have that problem. The reason that's so important is that 80% of your immune system lives in your gut. So it's a huge problem for people and really needs to be checked. And the other thing that's going to go along with that is looking for you to do a stool test. You want to look for parasites, yeast, bacteria, fungus. Again, because the immune system, so much of the immune system is in the gut. And that is just a component that really needs to be looked at and addressed. I talked about neurological. I have a certification in functional neurology. So not only when I do an evaluation on patients, I'm looking at the right and left side of the brain, because the right side of the brain controls the left side of the body, and the left side of the body controls the right side of the brain. That's a very simplistic explanation, but that's what we're looking at. And also I'm going to look at all the different lobes of the brain. The frontal lobe, the parietal lobe, temporal lobe, occipital lobe, all these different areas. Because in the frontal lobe controls our judgment, our cognitive thoughts, our impulse control. The parietal lobe, that part of the brain allows us to know where we can sense our body, where it is. And when you have a problem with the parietal lobe, you have pain in your body that you shouldn't have. If you have a problem in the temporal lobe, you're going to have a problem with short-term or even long-term memory. So we want to evaluate that as well. It's very, very important. And then third, we want to look at you structurally. I am a chiropractor, and so that's another really important aspect of evaluating a person with fibromyalgia or any chronic problem, is to look at the structural alignment, because the brain and the nervous system are controlling and running everything in your body. So I hope this short video has given you some insight into getting a better understanding of why you may be having some of the problems you're having and the unique approach that we have. If you're interested in having a consultation with me, what you'll need to do is call our office, 231-882-5533. When you call, we'll be asking you a few questions to make sure you're in the right place, and at that time we'll give you details on how to prepare for your first appointment. I'm Dr. Janine Johnson. Have a great day.